well circumscribed circular or oval hypoechoic nodule, and often more than one. Over more than one node is enlarged. So now let me give you the sonographic appearance. Sono appearance. If this is your image, we use the high frequency linear sequential transducer. The lymph nodes are superficial structures. So lymph nodes in the neck, you might see a discrete isolated lymph node, or you can say multiple lymph nodes. When you see the multiple lymph nodes, so these are the skin, this is the skin, and there will be hypoechoic, a little fat. So this is skin, this is superficial fat, then you will see oval shaped or circular. Sometimes you will see it is attached. Sometimes you will see it is isolated. Now, hypoechoic rim around the center. Hypoechoic, sometimes it looks very dark, close to anechoic. And you will see at the center little brighter. Why? According to the anatomy of the lymph nodes. Okay? According to the anatomy of the lymph nodes, these are the cortex. This is cortex. But this is medulla. And it looks like a sinus of the kidney. Sinus of the kidney is brighter, so here it is brighter too. Now, normally we don't feel it, we don't scan it. Incidental findings of lymph node you can see, but if patients complain, oh there's a bump, it is painful. It wasn't there 2 weeks before, now it came in. And it is more than one. Axillary group of lymph nodes has more than one, lot of. In the cervical, more than, in one textbook I read, there are average 300 lymph nodes in the neck. There are lymph nodes in the groin here. There are lymph nodes in the pelvic region and para-aortic, paravena cava, porta hepatis, There are lymph nodes. There is a group of lymph nodes. Those are signified for the pathology. So if you see in the neck, there is a lymph node here. How are we going to lymph node? You will see most of the time these lymph nodes are slippery. What does that mean? It is not attached with the skin. But if it is attached with the skin, it's a bad news. When the lymph node is enlarged, so these are normal. When the lymph nodes are enlarged, then you will see what? You will see lymph node is affected with something. Then you will see the sinus is gone, the medullary brightness is gone. You might see the multiple lymph nodes are matted together. What is matted means? Attached. They are attached together. It's a good sign or bad sign? It's a bad sign. Usually the lymph nodes are free, but why they are attached and multiple? That is a bad sign. In the lymphoma, the Burkitt's lymphoma, and there's another one, Hodgkin's disease, the lymph nodes are isolated, multiple but isolated. But in tuberculosis, they are matted together. And you will see like that, lymph nodes are enlarged, and you click the color. What are you going to see? If it is inflamed and is metastatic, there will be hypervascularity. There is a hypervascularity. Okay, so this is very important findings, that hypervascularity. Hypervascularity. But you need to know the anatomy of the lymphatic system. Lymph nodes are usually goes with the link or channel. So lymphatic system carries the lymphatic fluid from the extracellular level called interstitial fluid. Let me give the idea. Say if this is the cells in our body. So these are extracellular fluid. This extracellular fluid needs to be drained by the lymphatic system, lymphatic vessels into the vein. So these are extracellular fluid that needs to be drained by the lymphatic vessels. While it is going up, it has to enter into the lymph node. And then it's going out. Then it will enter another lymph node. Okay, now question. Why they are entering into the lymph node? Because lymph node is the checking center. Security checking. These extracellular fluids, usually they carry the infectious materials and the cancer cells. So they need to go through the lymph node. A lymph node is a security. If any suspicious materials are traveling through the lymphatic vessels, this lymph node will attack them, kill them, and will send the signal to the other lymphatic system, lymphoid tissue, to produce antibody against that antigen. These lymph nodes are also receiving the lymphatic fluids from other lymph nodes or lymphatic vessels like that. So they are getting the informations from other lymphatic organs and lymphatic nodes, and all those are coming and security check, and then it is going outside. Then it's get another security check on the lymph nodes. Why I'm drawing this? So now question is, if this lymph node is invaded by germs, or cancer cells, this information will go to this lymph node. That's why multiple lymph nodes are palpable. You can feel it. Why? Because it is a chain. If one lymph node is inflamed, so other lymph node will get the informations and they will respond to it. That's why lymph nodes will be enlarged. When the lymph nodes are enlarged, you see this cortical zone will be enlarged and hypervascular. And the sinus part or medullary part will be more small. And click the color, you will see this is hilum. Okay, this is called hilum. Hilum of lymph node. You will see the motion of the fluid is going like this is afferent, and this is efferent. Efferent lymphatic vessels. Afferent lymphatic vessels. Okay, that's why multiple lymph nodes are enlarged. Okay, so this is all about the neck. Now I will give the informations about the multiple endocrine disease called Mann's disease. Mann disease is a multiple endocrine neoplasia. Multiple endocrine neoplasia. It has two types. Mann 1 and Mann 2. Okay. Main 1 and main 2. So what are the endocrine glands get affected by the main 1? Pituitary, pancreas, that is islets of Langerhans, and parathyroid. Look, all of them are P, triple P. For your purposes, you just need to be little familiar with the main 1 and main 2 and what are the organs get affected. And main 2, the organs get affected is thyroid gland, parathyroid, and adrenal, medullary part of the adrenal gland. Medullary adrenal gland, and mostly it is pheochromocytoma. As I mentioned before, that this multiple endocrine disease they are mostly at the same time, or they may develop little different times. The reason of this, our body has a suppressor gene, and that suppressor gene our body has plenty of suppressor genes. They suppress the malignancy from happening. In our body. And if I think there will be 2s. If the suppressor genes have mutation, suppressor genes have mutations in their sequence. then neoplasia will be produced. And these suppressor genes are essentials and they are widely found in our body. There is suppressor gene for the breast. There is a suppressor gene for ovarian tumor. There is a suppressor gene for the thyroid, parathyroid, pituitary, and adrenal glands, pancreas, islets of Langerhans. If that suppressor gene cannot work anymore because of the mutation in their gene sequences, then suppressor genes are treated as non-functioning. So then what's going to happen? The cancer cells will be accentuated in our body. This mutation can come genetically. It runs in the family, like breast cancer, ovarian cancer, it runs in the family. Thyroid cancer runs in the family. That means suppressor gene can go into the descendant from parents to the children. Or suppressor genes mutation. I'm talking about the mutation. The mutated gene can transmit into the children from the parents. And these genes can be mutated from exogenous causes, external causes. We don't know exactly what could be the external causes, but you can think about if you go against the rule, your lifestyle is against the rule. So then understand, the ultraviolet ray causes cancer in the face for the squamous cell carcinoma, basal cell carcinoma. Excessive amount of ultrasound, that is ultraviolet ray. So that can cause mutation. Some disease can cause mutation. So in that way, there in our body, when the DNA is getting synthesized inside the cell, there is a proofreading mechanism by some enzyme. Proofreading. Is there any sequence change or mutated? What they do? They cut it off and dump into the recycling, and they create a new link and healthy link, healthy sequence, and that's why our tissue normally grows. Okay, just remember this main one and main two, what are the genes. Okay, so now I will go over tuberous sclerosis. Tuberous sclerosis, sometimes you will see, let's look at this face. Tuberous sclerosis. Tuberous sclerosis. What does tuberous means? Tuberous means it looks like a tumor, like you can palpate it, you can feel it. It could be round or oval, it could be elongated. Unusual thickening of the tissue and is harder tissue. Sclerosis is harder, non-functioning. The normal glandular tissue, parenchymal tissue turned into sclerotic, hardening and thickening. We call it atherosclerosis, thickening and hardening. This is sclerosis. So tuberous means looks like a tumor. And why is this been happening? It is again the suppressor gene is mutated. Sometimes you can see on the skin something unusual thickening in here. Sometimes they found in the breast called like a scar tissue. I'm going to give the name. And sometimes it happens in the brain. It happens in the eye, in the retina. It can happen in the skin, and lot of other tissue that is written over here. So tuberous sclerosis, it is not a good disease. Okay, so now this is a normal parenchymal tissue. And if you see that some area is getting thickening and hardening, so this is tuberous sclerosis. Sometimes it is not diagnosed. Unusual thickening. It is not a tumor, not a normal tissue, in between. And it happens more in the breast too. But it needs to be checked or followed up. Sometimes this kind of thickening may turn into malignancy. So tuberous sclerosis is a tumor-like and is thickening and hardening of the normal parenchymal tissue. It can happen to the skin, it can happen to the brain, it can happen to the eye, it can happen to any organ in the body. Mostly it can happen into the cystic duct, intraductal situation. Okay, so this is tuberous sclerosis. So next one is von Hippel-Lindau disease. Just know the name